Mr. Custard, who had settled close to Jefferson County. I reached out to Bob, and he was more than willing to come and interview with us and hear about our situation. And he has, I can say, devoted himself to helping us overcome many challenges that we faced in the last few years. Bob has studied geology and karst hydrology at the graduate level at West Virginia University. He has been a past state director of environmental health training for the Commonwealth of Virginia. He has been chief of environmental health for Alexandria City Health Department, and I am delighted that for the past, about 9 months now, he's been head of our Jefferson County Environmental Health Division. Bob's here today to discuss the recent audit that we requested from the State Office of Environmental Health Services, the findings which I gave to you about 6 weeks ago or so. Most importantly, I think Bob's going to share with you some strategies about how we are seeking to improve and protect the health of Jefferson County residents. So with that, I'll hand it over to Bob.
Good morning.
Good morning.
Afternoon.
Thank you. I would prefer that my first interaction with those of you other than Mr. Hudson, who I've met several times, was on a more positive note. As Dr. Didden alluded to, I came to the department when it was in crisis last May. Essentially, they had lost every one of their sanitarians, and they were struggling to keep the train on the tracks. One of the first things I did was create a continuity of operations plan that we could provide some minimum level of services so that establishments that needed to open could get open, so that developers that needed to have percolation tests done and permits issued, that we didn't delay development, and also to hire and train new staff so that we could get back to more of a business as normal. At the same time, we requested, as Dr. Didden alluded to, an audit of where we were to establish basically a baseline. Frankly, I've been working in environmental health for 32 years, in management for 30 of that. I've written a number of similar reports. I've been the subject of a number of these reports over the years. This is frankly the most damning report I've ever read. Basically says we haven't been doing our job. That said, I'm not going to dwell on that other than to say we're working rapidly to correct the deficiencies that are revealed by the report. And I want to be forward-focused. And moving forward, it's seldom productive, I believe, to point figures about what happened in the past, but more productive to face realities, be honest about where you are at the present, and then create an action plan to move forward in a way that will correct deficiencies and lead to a program of excellence. And that's what we're engaged in. Over the last 9 months, with your help, we increased the minimum compensation for entry-level environmental health specialists. And I very much appreciate your support in that regard. At the time I came, sanitarians entry-level were making $24,000 and some dollars. And for someone that requires a 4-year degree, they would come, they would get a year of training in which they were not able to do any regulatory work because they were not licensed yet. And then they would promptly leave for Maryland and Virginia and make $15,000 a year more. And so we were on a treadmill, and you helped us get off that treadmill, and I very much appreciate that. We've now hired 4 environmental health specialists. 3 are completely trained and working in the field. 4th one will begin work on Monday. I'm impressed with the quality of the staff that we're developing and I think we're on the right track. We've also hired a new environmental specialist, office services assistant, and they are doing very well. We've applied for a number of grants, which is new to the environmental health program here, and happy to report that we were successful in 3 of the 4 grant proposals that we've made. We're still waiting to hear on the 4th one, but they will significantly strengthen our food safety program. We have made a lot of progress in catching up on our inspections. I'm happy to report that as of this morning, all but 1 of the schools have recently been inspected for food safety, and that one will be completed today. And by the end of this month, all the daycare centers here in the county have been inspected recently. Our focus here is on the most vulnerable population first, and so we looked at child care centers and schools, and as soon as we're completed with those, we will be moving on to a rather large inventory of restaurants, about 350 here in the county. So we're making good progress in that regard. We've kept up with our foodborne illness investigations and complaints. We've managed to start a new program to facilitate closings for low and no interest loans to correct failing septic systems through the state. We've taken over responsibility from the rabies program from another part of the health department, and we've managed to keep up with our well and septic applications over the last 9 months, which is frankly pretty miraculous given the turnover of staff we have. I should acknowledge that good folks at the Office of Environmental Health Services in Charleston provided staff for about 50 work days along the way while we had people in training to help us keep the train on the tracks. The audit certainly has revealed some challenges, and we'll probably talk about those more. I think Nathan's indicated that there's probably been an executive session here in a little bit. But I would like to say a little bit about what we plan in the next year. Specifically, I intend to create a food safety advisory council representing industry and regulatory folks and consumers that will help guide us as we roll out the new 2017 food code. We're currently operating under the 2009 version. And I expect the state will adopt the 2013 food code this spring. There are very few differences between the 2013 and 2017. So our intention is to move directly to the 2017 rather than having to go through implementation twice. We will provide training to industry on the changes in the code, and I expect this will go fairly smoothly. I actually implemented a similar program in the city of Alexandria, which has quite a few food establishments, as you can imagine, and it was very successful. We also are working hard on getting our health department files squared away, and they've been in rather, both the paper copies and electronic copies, been in disarray. We expect on the permitted establishments to have that squared away by the 1st of April. Our sanitarians are becoming more proficient in evaluating soils, and I hope that by summertime I'll be able to step back a little bit and do more in terms of program management and less actual time in the field. We are also working hard at training our staff on investigation of foodborne illness. We haven't had any outbreaks, fortunately, but that's an area that they still need some training. Beginning in July, we're going to begin posting our food safety inspections on the internet again. I know a number of our citizens have missed that, and we will have, by that time, gotten around to inspect every establishment in the county, and there'll be recent and reliable data that we can post to the internet. We also will be completing a self-assessment of our food program according to the FDA program standards. There are 9 voluntary standards that the FDA promulgates.
Question, if you don't mind.
Sure.
These failing septic systems, are these localized to one portion of the county more so than another, or is it just rampant? And those 2 issues you just mentioned, I mean, are they part of the same area of the county, or?
The 2 incidents where there were E. coli infections were broadly separated in the county. One was in a karst area, one was not. One was in an area of dense development, one was not. So these problems can be in a variety of settings. I would say the most failing systems we're seeing are in areas like Shannondale, where you have older homes that were originally built as weekend cabins, maybe in the 50s and 60s. People never anticipated them becoming year-round residences, and the density of development there is considerable. It's not the only place we're having failing septic systems, but I see probably more up on the mountain than. Of course, we have more density of development up on the mountain as well. So,
you said something about collecting data and to sample wells and so forth. And how do you do that? I mean, do you just send out letters to homeowners of areas that you have concern to gain permission? I don't know how that works. Or can people bring in oracles? I think a lot of people would like to take advantage of that, but I don't know the process.
We haven't established a process. I can tell you what some other jurisdictions have done. Some have worked with the Agricultural Extension Service to provide an educational program for homeowners, and then as a follow-up to that, offer them well sampling. The question is who pays for the laboratory fees? And so one of the things we may try to do is find some grant funds that would fund some sampling. I hope that as we pull together the data that is available, and we have something between 750 and 1,000 well samples that have been submitted over the last 5 years to the health department's laboratory, that maybe we can see some patterns if we can get this intern to analyze that data and identify areas of greatest concern and focused on those first.
Well, and I'm very familiar with our area. I live near Lee Town, and you may not be aware, but when the landfill was closed, it was because it was leaking, and there were several test wells around that whole area. They were dyed, and I think also the Lee Town Fish Hatchery has done dye tracer tests. So in that area, it's older data, but be valuable, at least if you're looking for patterns and trying to research difficult areas.
I do want to emphasize this is a long-term project.
Right,
It's not
right.
something, we still got to get the train moving
Right.
on the tracks
Yeah.
before we undertake a lot of larger, long-term projects. But I wanted to share with you a vision for where we're trying to go.
Well, and I understand it's a long-term project, but I'm really concerned with our recent weather patterns, that the problem has been magnified. And,
I would agree.
I don't know how you how you deal with that, because it is a big, huge project.
You want to talk briefly about how people who want to get their well tested now go about doing that?
If you want to have your well tested, you can pick up a sample container from the state lab, which is in our building.
Right.
And I believe the fee to have that well tested is $20. They will spend a little bit of time telling you about proper sampling procedure, but as if we want a scientifically valid study over the long term, we would want to have trained persons collecting those samples so that there is some standardization of process. That said, at this point, we're going to look at all the data that's available because any data is better than no data.
Well, and particularly for folks that are in an area that is still flooded. It'd be good at least to get that basic sample done, even if the pipes aren't great. That could-
Quick thing too, I don't normally suggest something like this, but yeah, $20, I mean, to some folks that's minuscule. I mean, others, I mean, this is like water quality and we represent taxpayers and that's a serious issue. Maybe the commission should consider helping provide some sort of fund based on income level to pay that fee or something along those lines.
Yeah, we could look at
Maybe at budget time or something, but
budget time and can come up with a way that,
some
yeah,
sort of
can,
threshold or something.
Be happy to answer any other questions.
At this point in time, I have a lot of questions, but because of the time we're under, I think, I know that I'll get them answered at some point, but
I just have a question, probably more of a comment that I don't think you can answer. I've been called since you've taken off or since you started working there. One, basically, somebody worried that you were going to cause the whole pollution of the Shenandoah River. I'm going to tell you the truth. And then the second person called me and thought you were going to be over-regulating everybody. So I got both views. So you got your hands cut out, or your job cut out for you.
I haven't heard about the Shenandoah River one, but I did hear about the other one.
Change is difficult for people sometimes. There certainly, as our audit points out, were some significant deficiencies in the past, and we have had to make some changes to comply with what's in our state code. And I think Mr. Cochran wanted to maybe have a few minutes in executive
Because
session.
of the time constraints, I think perhaps, I just want to advise you of a couple of issues that may be could lead to litigation, and but what I could do, gentlemen, I think I could just inform them of that, and the Board of Health has a board meeting tomorrow, and I'll raise those issues before the Board of Health as well, okay? So as far as I'm concerned, you all can leave, and in my executive session time, briefly advise you where we are.
Thank you. Thank you so much. I appreciate your presentation. It's great to meet you. Good luck, and look forward to seeing good things in the future.
Thank you very much.
So that brings us to Nathan, your
First the sheriff is here, I know, and there's an issue, my last issue is the intergovernmental agreement with Bolivar. So to avoid the sheriff having to wait around any longer, could we deal with that for?
Absolutely, sure.
We've asked for something when he's here.
One down, Pete.
I should have actually skipped ahead to that before we talked to these folks, but hopefully we didn't.
Okay.
Crime is rampant because of you, Nathan, I'm sorry. We all know the sheriff's here.
This is very simple. The Corporation of Bolivar is proposing to do an intergovernmental agreement between my office and the commission. They're moving to do a hotel motel tax. They were the only entity in the county that had not done it before. They've asked to do it. My office would take the responsibility to collect for them, and as we do with other tax, we just remit it back to them, and they will pay $1,000 a year for us to handle the income coming in and the money going back.
Does that pay for the labor?
Yes, it would be sufficient to cover the cost for us to do it.
Good. I'm glad they're going to start collecting that.
Yeah, it's very helpful. I think they're finding that it will be very helpful for them.
Right.
And obviously, as you know, most of that money goes into marketing to get more business and so on, and more tourists, and obviously that's a very key issue for them.
And I reviewed the agreement, and I believe it's acceptable, so.
I move we approve the intergovernmental agreement with the Corporation of Bolivar with the Sheriff's Department for tax collection services.
Second that. Is there discussion? Hearing none, all in favor signify by saying aye. Aye. Opposed? Thanks, Sheriff.
You. See you next week.
I know, right?
Yeah, that's right.
I got some new info today.
The next issue that I have, and I don't know if you really want to take this up today or not, but the Charlestown's request to allow parking in the parking lot, I don't know if you want to deal with that right now. I have not created any documents or anything because we have not, you have not, decided collectively whether or not you really want to do that or what form it would take. So therefore, I'm just bringing that up to you, and I'm not
Well, I
doing
have an
anything.
opinion, but I don't know if we have time to
Okay.
deal with it today. With everybody.
I have a quick opinion too. Does anybody else have a quick opinion?
I have a quick opinion. I have an opinion that I don't think we should do it.
Concur.
And based upon information that when we were at the court security meeting, there are issues with security and other issues as far as maintenance and all that. But
And we're already
security is the
renting
biggest issue.
parking space from them for our staff.
Yeah.
A question, no. It's an open lot. I know there's signs, but it's an open lot. I think we're liable people park there.
We are. Right.
And I don't think there's a way to stop them at this point unless you put gates up.
I mean, we may be, they would certainly be, they would not be an invitee or anyone that has permission to show up on the lot. I mean, all of that stuff is kind of fuzzy, but likely if someone got hurt there, we would end up getting pleaded in some kind of suit. Successful or not, that's another.
Sorry. I know that Bill has gotten a redesign of the parking lot. I wanted to put up gates because right now we really rely on Brian to tell people to move, and you know, he did that once and some guy like wanted to sue us, right? Yeah. So I thought that it would be nice to have gates like they have at the 911 center where employees would have swipes, and I think that the plan includes adding those gates. If we add those gates, we wouldn't be able to do it anyway. Now, I don't think that you funded those parking lots
No.
correctly.
I think we just saw a very basic
Yeah.
outline of what
Right.
could be done,
They
but
were
I don't
willing
think
to
we
put
have a
up-
price.
They were willing to put up signs, but that was pretty much the extent of their.
Right.
So do we need a motion to not, or do we need a motion to?
I
don't know.
I don't really
Or
think
just
you
take
do,
no
because
action.
it was just presented to you. If you take no
Okay.
action, then there's no action taken.
Okay.
But I just wanted to
Just-
bring it up because that was one of the things that had been, kind of directed to me, so I'm just bringing it back.
Okay, so, all right, so let's move on, if everybody's in agreement to do that. Okay.
Okay. I think we could represent to Charlestown
Yeah.
representatives that it doesn't, you haven't taken an action, but it
Yeah.
does.
Okay,
Right?
that'll work.
It's very diplomatic.
Okay. Then everything else, I think that because of your meeting yesterday with Mr. Kennedy, I think you've dealt with several of these other
Right.
issues. We're still on hold on several of the other issues. Nothing has happened. So that brings us down to the Board of Health issue. And because there has been some threatened litigation that could possibly involve the commission or would certainly involve the Board of Health, one of your agencies, I request that we would go into executive session.
All right, I move we go into executive session to seek legal advice regarding the Board of Health septic tank permitting process and procedures.
Second, is there discussion? All in favor signify by saying aye. Aye. Opposed? And we're not going to take up number 8, there's really nothing to discuss. And so we're not going to discuss anything with that today, so I'm assuming that after we finish with the executive session, we will adjourn.
And then come back at 1:30.
And reconvene as a board reviewing equalization at 1:30.